This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses or simply click on the link in our show notes and create an account.
So you have a patient who comes in and who's, let's say, overdosed on heroin and demands to leave right away. You've watched them for, let's say, an hour. What's the right thing to do? Does the patient have the right to leave? So are they medical? Yep, they're not suicidal. They're not. It's not a psych issue. So with heroin's a shorter acting drug. So after an hour, if they're not hypoxic, they usually are pretty safe to leave, and the patient does have the right to leave even against medical advice. So what should you do in that case to try to keep that patient safe, and also to send the message that the emergency department is a place that cares for them and wants them to overall survive and do well? Send them home with Naloxone or Narcan, right? And this has been an idea that's been around for decades. That we know that if you give people a prescription for Narcan and they fill it, those patients are more likely to survive. And we know that that patient who you just saw, who overdosed and came to the ED, what's the chance that they're dead in 1 year? It's 10%, right? So there's a really high mortality rate for our patients with opioid use disorder. But if you send them home with Narcan or Naloxone, the fact is that they have better survival. They're more likely to enter into recovery, and they're more likely to use that Narcan on a friend who's overdosed or someone else. So it really is one of the most powerful tools that we have to help patients get into recovery and overcome their opioid use disorders. The problem is if you give them a script, what happens? They don't fill it, right? And there's many reasons that they don't fill that script. A lot of times it's because of the stigma. A lot of times they're a person with a full-blown use disorder, so they're not really thinking as rationally as they should be. So the best thing to do, which is best practice, is just put that naloxone in their hands so they have it with them when they leave. And we're very fortunate that we're the second place in Colorado that's done this, have a take-home naloxone program. The cool news is that beginning on April 1st, every Health 1 emergency department is going to be using Narcan that we can send patients home with now. A few of the caveats there is who should get Narcan. That's the obvious one, right? They've overdosed on heroin. They should go home. That's like no crap, Sherlock. Who else should go home with Narcan? So any illicit drug use, if your patients are using methamphetamine is often cut with fentanyl nowadays. So if they're an injection drug user, you should send them home with it. So if they're using illicits, basically, they're a good candidate to go home with Narcan. And then the other group is people who have chronic pain and who are on opioids, but have things that make their use of opioids danger or more likely that they're going to overdose. So if they have COPD and they're taking chronic pain medications, if they're taking chronic pain medications and a benzodiazepine, they should go home with Narcan. If they have obesity and sleep apnea, right? If they have things that compromise their respiratory system, or if they have liver disease or renal disease, all those patients should be going home with Narcan. And now we have the capability to do that for them, right? And then what's the other important thing? Tell them how to use it, right? And the nice thing is we're switching from the self-assembled kits. And have you guys seen those? It's kind of got 3 different pieces. You have to screw one piece in the other, then you have to take off this little cap, and then you have to screw that in, and then you have to put it all together, and then you have to screw it in someone's nose, right? So if someone is dying right in front of you, how good do you think you're going to do about doing a new task, such as assembling a take-home Narcan kit? The answer is you're going to do really piss poor. And there's evidence that also shows those kits are great. They're much, 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 much better than nothing, but they're also not as good as the single-use kits. And also in the era of fentanyl, where the self-assembled kit is 2 milligrams, a Narcan one is 4. So it's actually more drug that's delivered more efficiently. And we're going to be moving all to Narcan, kind of the trademark drug product. That's going to be much easier for your patients. And it's pretty self-explanatory. There's like a little plunger. You put it in the nose, you squirt it. And then the other important things is, do people Narcan themselves? No. Typically no, right? So it's important to give that patient counseling, that they should talk with their friends, talk with their family, let the people that they trust know that there's Narcan in the house, where it is. And that's it. So it's really cool we get to do this now across the whole system. And it's part of a larger project called the Colorado Naloxone Project. There's a cool website which has videos which you can send patients home with and a bunch of patient materials. So we should use that. And thank you guys for what you do.
Thank you.
The Emergency Medical Minute would like to thank our sponsor, Swedish Medical Center, for helping fund our nonprofit organization and make this podcast possible. Donations are essential to our organization to cover operational costs and fund the creation of our online courses offering AMA, PRA, Category 1 credits. So if you enjoy our show, and if you're able to make a one-time or recurring donation towards our organization, any amount is helpful. Please click the link in our show notes to make a donation. Thank you for listening.